Hello, everyone. Welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for February 19th, 2020. Thank you for joining us this month. Our presenter today is Katie Huffman. Katie has a master's in gerontology and is a program associate with the Osteoarthritis Action Alliance. Her presentation today is titled OACareTools, Engaging Primary Care Providers in Osteoarthritis Prevention and Management. As you'll learn today, this is a free educational toolkit that we launched recently with information and tools for both primary care providers and their patients. Katie spearheaded this effort as the project manager, and we're excited to share it with you today. Welcome, Katie.
Thank you, Kirsten, and thanks to all of you on the call for joining us today for our presentation about OACareTools, a toolkit to engage primary care providers in osteoarthritis prevention and management. I'm excited to share this toolkit with you, and I hope by the end of today's presentation, you will be excited to share it with your colleagues and networks as well. I want to mention that OACareTools was funded in part by a Pfizer independent grant for learning and change, and the Osteoarthritis Action Alliance receives funding through a cooperative agreement from the Centers for Disease Control and Prevention. That being said, the toolkit contents were entirely developed by the Osteoarthritis Action Alliance and our stakeholders and are based on best evidence and best practices in medicine. To set the stage for OACareTools, I'm going to start by reviewing some osteoarthritis prevalence and burden statistics and the role of primary care providers in osteoarthritis care, which will also be a good chance to show you some of the graphics and content we use in the toolkit. So some of the information that we use to make the case for the importance of osteoarthritis in primary care. Then I'll describe the process we use to develop OACareTools, provide an overview of the toolkit content, and discuss dissemination strategies and reach to date. I'll end with the next steps as we see them for OACareTools, and then we'll have some time for question and answers. The CDC estimates that 54.4 million US adults have some form of arthritis, and that's expected to grow to 78 million by the year 2040. There are over 100 types of arthritis, with osteoarthritis being the most common form, affecting 32.5 million US adults, or 1 in 7. The high prevalence of arthritis does result in significant costs to society and to patients. While arthritis pain is extremely individualized, severe joint pain is not uncommon, and approximately 1/4 of adults with arthritis experience severe joint pain, which is characterized by a score of 7 or greater on the 0 to 10 pain scale. That amount of pain certainly does have an impact on people's daily lives and their ability to maintain their routines and activities, to where almost 44% of people with arthritis experience limitations in their daily activities. And as you can imagine, with the high personal cost comes a high economic cost as well. When looking at lost earnings, disability benefits on top of direct medical costs like hospital stays, doctor visits, and medications, osteoarthritis costs over $130 billion annually. And in 2013, it weighed in as the second most costly health condition treated in US hospitals. The burden of osteoarthritis also plays out in its relationship to comorbidities, in part because of its impact on a person's ability to engage in physical activity, which we all know is a key treatment for diabetes, high blood pressure, and heart disease. The role of the primary care provider is integral in osteoarthritis care. Primary care providers often make the initial diagnosis of arthritis, and these providers are well equipped to coordinate management of arthritis as well. Many patients with osteoarthritis present with one or more comorbidities that are also managed in primary care settings like heart disease, diabetes, and obesity. And it's believed that mild to moderate arthritis can easily be managed in primary care with interventions like increased physical activity, maintaining healthy body weight, preventing injury, improving psychological well-being, and disease education. And all of these strategies are beneficial for the other comorbidities that are being treated in primary care as well. Early on in our toolkit development process, we decided that we really wanted to emphasize the relationship between osteoarthritis and comorbidities. Over 50% of people with osteoarthritis have another chronic condition, and over 30% of people with osteoarthritis have 5 or more chronic conditions, most commonly heart disease and diabetes. Looking at that a little bit differently, 49% of people with heart disease and 47% of people with diabetes also have arthritis, and 30% of people who are obese have arthritis. And so why is this important? Well, thinking back to what I mentioned a minute ago about the level of joint pain and activity limitations people with arthritis experience, we know that osteoarthritis gets in the way of people's ability to be physically active. 50% of people with severe joint pain are not physically active compared to 25% of people with no or mild joint pain. And of course, inactivity makes it harder to manage obesity, diabetes, and heart disease. All of this can result in a vicious cycle where osteoarthritis and its related pain and disability can contribute to obesity and the worsening of other chronic conditions. So all of that background leads us to our primary care provider toolkit, which the formal title is Engaging Primary Care Providers in Osteoarthritis Prevention and Management Education. We shortened this for a variety of reasons to OACareTools, and so that's how I will refer to it during the presentation. The Osteoarthritis Action Alliance developed OACareTools in partnership with United States Bone and Joint Initiative with funding from a Pfizer Independent Grant for Learning and Change. In our grant application, we propose to develop tools and resources for 2 principal groups. The first being primary care providers to improve their ability to recognize, diagnose, and treat osteoarthritis, and for their patients with arthritis, to empower patients to undertake self-management strategies like physical activity, weight management, injury prevention, and education. OACareTools can be found for free online at oacaretools.org. And when thinking about primary care providers, we use a broad definition to include family physicians, general internists, nurses and nurse practitioners, physician assistants, physical therapists, occupational therapists, sports medicine professionals, athletic trainers, fitness professionals, so a wide range of providers who might see patients with osteoarthritis. And relying on our relationship with many organizations across the country, we convened a stakeholder panel of representatives from the various professional groups to advise us on the toolkit development. We had representation from nurse practitioners, physician assistants, the American Council on Exercise, the American Chronic Pain Association, sports medicine professionals, physical therapy, the Association of Rheumatology Professionals, and athletic trainers. Additionally, our stakeholder panel included UNC physicians and rheumatologists, physical therapists, and researchers. And by joining our panel, these individuals agreed to help with content development and dissemination of the toolkit. We also had very helpful input from patients along the way. The timeline that was laid out in our grant was 18 months, beginning in November of 2018 and ending here in the next couple of months. We began with a kickoff call with our stakeholders to determine the gaps and needs in osteoarthritis care from the provider's perspective. And then after hearing from them, we spent the next 8 or so months developing content in partnership with small groups of those stakeholders, and then later working with the UNC Graphic Design and Web Services team to put the online toolkit together. The toolkit was officially launched on October 1st, 2019, and since then the Osteoarthritis Action Alliance and our stakeholders together have focused on dissemination and promoting the toolkit as widely as possible. So diving a little deeper into how OACareTools was developed, back at the kickoff meeting in November of 2018, we asked stakeholders two main questions. What are the gaps in osteoarthritis care that you would like to see covered in this toolkit? And what types of resources for providers and for patients would you want to have access to? And what is the best format for those resources? So you can see here some of the themes that emerged from our first stakeholder call. Stakeholders thought it was important that the toolkit expressly describe osteoarthritis as a serious disease to underscore its significance in primary care. Providers wanted information about how to detect arthritis, particularly early in the disease state. They asked for treatment guidelines and best practice interventions. They wanted to understand the role of different providers in osteoarthritis care. They wanted specific guidance on how to talk to patients about self-management strategies like weight loss and increasing physical activity. And finally, they wanted information and links to community resources. On the first and second stakeholder calls, we got some really good feedback on toolkit functionality and design as well as content. So our stakeholders wanted the content to be laid out non-linearly, which would allow providers to select the material that they would interact with. They wanted the content to be multimodal in both delivery and dissemination. So they suggested having printable resources as well as online or electronic versions. And they suggested using a combination of audio and visual formats. They recommended that we include resources that could be discussed with patients in an appointment or that patients could review on their own. They also recommended that we use case studies to demonstrate the points of the toolkit. So the feedback in that first stakeholder call really laid the groundwork for our toolkit development. And in the end, our toolkit contains 9 separate educational modules, case studies, information on community resources, downloadable patient handouts, tips for talking about behavior change, osteoarthritis prevention strategies, and so much more. And all of these components came together as OACareTools. You can see on the right-hand side of your screen is a graphic from the toolkit landing page, where when you go to oacaretools.org, you will see these 9 tiles, and you can kind of choose your own adventure. So you can click on any one of those 9 tiles to learn more about that topic. Then after selecting one of those 9 tiles, you will come to the content page, which will look something like this. All of the content for that module is available on a single web page, and that page includes navigation there on the left. So if you wanted to jump to a certain section, you could go farther down on the page. The modules themselves all contain links to other relevant modules and to outside resources as well. We also have links that allow you to download the patient resources that are applicable to that information. Viewers have the option to print or download or print a PDF of the module, and that PDF includes identical information to what's on the website. It's just more printer friendly and can be used offline. We have a lot of really good content on the Toolkit website, which I do hope that you all will be able to explore on your own, but I wanted to bring your attention to a few things in particular. First, the clinical management of osteoarthritis module is probably the most comprehensive module, and I feel like that's where a lot of the meat lies. At the advice of the Osteoarthritis Action Medical Director, we broke this clinical content down into 2 sections, non-pharmacologic and pharmacologic management strategies. And these modules have been updated with the latest ACR recommendations. They contain links to external programs and resources, particularly self-management, education, and physical activity programs that could be found in the community. These include programs like Walk with Ease, Chronic Disease Self-Management Program, Enhanced Fitness, and many of the evidence-based programs available for people with osteoarthritis and other chronic diseases. This module, I think one of the unique things about this module as well is a table that we put together describing the common specialties that are involved in osteoarthritis care. So we polled all of our stakeholders, and then they talked with their colleagues as well, and sent in comments and thoughts about what their particular profession contributes to osteoarthritis care. So I think it lends a unique view from inside the profession to what they contribute to patient care. Another module, as I mentioned, does include 4 patient case studies. These were developed by clinicians. And the content of these cases really highlights the take-home points of the toolkit. For example, the relationship between osteoarthritis and comorbidities, how providers might detect osteoarthritis in a primary care setting, common treatment strategies and best practices for referrals, and another important topic area, osteoarthritis prevention. In our case study module, we do include multiple choice questions with answers and then links back to the relevant modules and any patient handouts or patient resources that are applicable. So another content area that I wanted to bring to your attention are the 3 custom patient handouts that we developed. And these can be found in various modules of the toolkit, depending on what the topic areas are. One of our handouts focuses on prevention and self-management strategies, and it does include a URL back to our website where all of these programs do have links that the patients could access online. A second handout provides an overview of osteoarthritis, so just a quick form of education for patients about the condition and some common risk factors and treatment strategies. And then finally, a third handout includes lists and links to the various community resources for people with arthritis. So all of that content from the toolkit are just a few samples that you will find at OACareTools.org. And I hope you will take a minute to explore the website on your own. But with such a great resource, we want to share it with as many primary care providers as possible. And that leads us to the dissemination process. Under the terms of our grant, we said that with the help of our stakeholders, the Osteoarthritis Action Alliance would concentrate on dissemination for a 6-month period. So we launched the toolkit back in October, and at the initial time of our launch, we wanted to help our stakeholders with their promotion efforts. So we developed a media kit. You can see the purple button there on the screen, share this toolkit using our media kit. That button is found at the bottom of the toolkit homepage and takes you to a folder full of tools to help promote the toolkit. It includes ready-made Facebook, Instagram, and Twitter graphics. There's a sample newsletter entry, some sample social media language, and full page flyers. There are some PowerPoint slides with just general information about the toolkit that could be shown at meetings or conferences. And then I've included here 2 samples of our social media graphics that we put together that you can use to share the toolkit. In addition to asking our stakeholders to promote the toolkit through their networks, we also asked them to try and measure their reach as much as possible. And we created a spreadsheet to help them record metrics like social media impressions and engagements, newsletter opens and clicks, web page views, number of conference attendees, and so on. And the Osteoarthritis Action Alliance is also collecting this information for our own outreach efforts. These are some of the organizations that have already helped promote us, OACareTools, and we know there are others out there. We still have a bit more time for metric collection. We're waiting to hear back from all of our stakeholders on what they've been able to do. This is just a very early view of the types of numbers that we are seeing from the combined efforts of the Osteoarthritis Action Alliance and our stakeholders. You can see that we've had some impressive numbers of people reached, which ultimately resulted in over 4,000 page views of the Toolkit landing page. We've had almost 3,000 unique individuals visit the landing page, and then you can see our most popular modules so far have been clinical management of osteoarthritis, osteoarthritis prevention, and then osteoarthritis prevalence and burden. We still have about 6 weeks to promote the toolkit and collect our metrics from stakeholders. And even after the grant period comes to a close, we plan to promote the toolkit because we do think that it's a valuable resource. So even though the grant period is ending, we see OACareTools as a living resource, which we will continually update and add to. Some of the ideas that we've had already just for developing new materials that we hope we can put some work toward in the future include new patient resources. And then we've had some advice from our stakeholders to develop companion pieces for providers that might condense the current toolkit into more focused action briefs or other materials that can be digested a little bit more quickly and more easily than the existing website. We would love to be able to develop some motion graphic or live interview style videos for patients and providers that again are quick and catchy and get the points across. And then of course we will continue to focus on getting the word out there about OACareTools because we want to get this information into the hands of primary care providers across the country. And so that's where you all come in. I added the purple button here on this slide just as a reminder that we have lots of tools available to help spread the word about OACareTools. And this button obviously isn't clickable from the slides here, but you will find that button on the bottom of the Toolkit homepage, and we'll send out a follow-up email to all of the people who registered for the webinar about how to access the toolkit and the media kit. And lastly, as I mentioned, we do see our toolkit as a living resource. So we hope that if you have ideas for other content that would be helpful to include, please reach out to me. Also, we hope that you will leave the webinar today feeling inspired to spread the word, whether it's to tweet about OACareTools or mention it to a colleague or even throw up a slide about it at your next professional conference. We hope that you will help share the information across the country. And so again, just include the URL here and we will send that out in a follow-up email. So I think at this time we have a little bit of time for a few questions if there are any.
Thank you, Katie. Really nice, comprehensive overview of the toolkit. And I think it's super useful for our providers. And while we're waiting for anybody to chat in any questions, I wonder if you could clarify just a little bit how you envision providers using this toolkit.
Mm-hmm. Sure. Well, the toolkit was designed to be self-study so that providers can jump in and out as their needs determine in terms of their medical background or their area of practice, their patient needs. But I think there are other ways that it could be used, especially for maybe providers who are pretty well versed already in osteoarthritis care and its management. There are obviously the patient materials that can be downloaded. We had providers say that those would be good to use in their waiting rooms before appointments, or that could be handed out specifically to patients with osteoarthritis to share some of the information and resources for them. We also had a few stakeholders just in the development process have some ideas about how the toolkit might fit into their existing practice. For example, we had a primary care physician talk about a chronic disease management program that's in their practice where the provider could refer a patient with osteoarthritis to a mid-level practitioner who could do more of the counseling on osteoarthritis and trying to encourage the patient to participate in physical activity, weight management, which would help with their other chronic conditions as well. Another suggestion we had from stakeholders was to use the toolkit in academic and training programs so that providers in training would have access to the information early in their careers. And then another good idea, which we hope we can get to work on, is we had someone mention using portions of the toolkit in grand rounds or another type of in-service education within a department. So maybe trying to come up with a PowerPoint or some other type of presentation that could be used that gets the information across.
Thank you. Those are really helpful. I think that just clarifies for folks just how to take away and digest a lot of this. And I know when we first started working with our stakeholders, and you mentioned this in the beginning of the presentation, that we asked all of them to sort of highlight where they thought there were gaps or needs in primary care education or disseminating information. And of course, we tried to be really thoughtful. The toolkit is comprehensive with quite a bit of information, but we hope it is digestible and addresses different learning styles. But with all the information that is out there, what makes this toolkit different from other OA resources that are available to providers?
Yeah, that's a good question. I know there are a lot of resources competing for providers' time. Well, I think that as you mentioned, the toolkit is very thorough, but it is arranged in the 9 modules. So I think that providers can come to the toolkit with a variety of backgrounds and get the material that they want or need without having to read through the whole toolkit. I think our patient resources, both the downloadable handouts as well as the links to other websites, I think that's a unique feature, and we hope to develop that a little bit more in the future. I think that one of the unique aspects of the toolkit is the engaging patients and osteoarthritis care. We thought it was important to help providers have a framework or a way to dialogue with patients about these difficult conversations with lifestyle changes like increasing physical activity or weight management. Those are hard conversations to have. I think having a few tools or even just a few quick questions in their back pocket can be extremely helpful in getting that conversation going. And then I mentioned already the referral table and the clinical management of osteoarthritis module, but that was one of my favorite resources that we put together. I think it was just kind of fun to have all of the different provider specialties contribute what they think their profession contributes to patient care.
Yeah, I agree. I think that's so helpful since we had such a broad definition of primary care providers going into this. It was even surprising to me sometimes to hear from some of our stakeholder professional folks and how they see themselves. I totally agree. I think people don't necessarily consider, for example, fitness professionals to be on a care spectrum, but in fact, many of them are. So that was good to see. We are approaching our 30-minute time frame, so while if anybody has any last questions they want to type in, go ahead. I'll just give a quick shout to our presentation next month for those who need to hop off. We will be presenting on March 18th, a very interesting webinar on the role of weight bias on health outcomes. We won't be presenting. That will be with Dr. Fatima Cody Stanford. She is an obesity medicine physician scientist and educator and policymaker up at Massachusetts General and Harvard Medical School. So I strongly encourage all of you to come back and join us for that one. I think it'll be extremely interesting, and to share that opportunity with your colleagues and through your networks as well. So with no more questions that I see, thanks everyone for joining us today. That concludes our presentation, and thank you very much, Katie, for sharing all of this.
Thanks for having me.
Bye-bye, everybody.